Medical intern is a term used in some countries to describe a physician in training who has completed medical school and has a medical degree, but does not yet have a full license to practice medicine unsupervised. In other countries, medical education generally ends with a period of practical training similar to internship, but the way the overall program of academic and practical medical training is structured differs in each case, as does the terminology used. Australia. In Australia, medical graduates must complete 1 year in an accredited hospital post prior to receiving full registration. This year of conditional registration is known as the intern year. An internship is completed not necessarily in a hospital at the same state as the graduate's medical school. This indeed depends on personal factors as well as professional career aspirations. Brazil. In Brazil, the medical course consists of 6 years or 12 semesters. The last 2 years are said to be the internship. During this time, students will undergo extensive hospital hours and do basic hospital work while supervised by both residents and staff. Usually, this period is divided among clinic, surgery, gynecology and obstetrics, pediatrics, social medicine and a final elective period in which the student may choose an area in which to gain further experience. Upon conclusion of internship, the student graduates to a doctor, and may then work unsupervised in basic functions or enter a residency program in order to gain a specialty. Chile. After high school, medical course in Chile consists in 7 years, having 5 years as a medical student and 2 years as an intern to obtain the degree of MA Copyright Dico Cirujano. Internships should at least include the 4 basic specialities throughout this period. After completing the internship, the new physician may work in primary care, hospitals or apply to residencies for a specialty. Dr. Congo. Dr. Congo has a 2 years internship program for public health schools. Many hospitals employ doctors prior to their full registration with the Medical Council. Ecuador. After finishing high school, students have the possibility to apply to medical school. Medical school generally consists of 5 years of medical school and 1 year of internship, through which the student rotates through different surgical and clinical specialities. After this, the student gets the title of medical doctor. Additionally, there is 1 compulsory year of community medicine in order to obtain the medical register and license from the Public Health Ministry. After this, the MD has the possibility to do residency or apply to a specialty. Egypt. In Egypt, after medical students complete their 6 years of studies, they require 1 year of internship or clerkship training in a university or teaching hospital. During this year, the student must complete 2-month rotations in each general surgery, internal medicine, pediatrics and obstetrics gynecology. They also must complete 1-month rotations of their choice in each a subspecialty of surgery, subspecialty of internal medicine, anesthesiology and ER medicine. Once the student has completed their internship, they are awarded a Bachelor of Medicine and Surgery. There are also 2 years of mandatory service in an underserved area. If the medical graduate fails to complete these 2 years, they are not allowed to work in a university or teaching hospital and can only work in a private hospital or clinic. Ghana. The housemanship is a 2-year period after graduating from medical school during which newly qualified doctors practice under supervision in designated hospitals in the country. This involves 6-month rotations each in medicine, surgery, obstetrics and gynecology and pediatrics in no particular order. Alternatively, a houseman may opt for a rotation in anesthesia or psychiatry in place of one of the traditional 4 rotation areas. During this period, the houseman is given provisional registration status with the Ghana Medical and Dental Council and would only be granted full registration status after successfully completing the housemanship. They then assume the rank of medical officer. India. After 4.5 years of medical school, every doctor in India has to go through a 1-year compulsory rotatory internship in various specialities to get permanent registration in Medical Council of India as a physician. Only after getting permanently registered with MCI, one is licensed to practice medicine as a primary care doctor throughout the India. dental sciences students to undergo compulsory internships for 1 year, without which degree requirements are not considered full, and professional license to practice is not entrusted to an individual. Iran. In Iran, internship is an 18-month period at the end of the 7-year medical education which should be done in the university hospitals. Then, medical students can graduate and work independently as a medical doctor or participate in National Comprehensive Residency exam and continue to study in desired specialty. If they decide to work as a general practitioner, they should first do their compulsory service for a period, regarding their national service or their individual status, in underserved areas recognized by Iranian Ministry of Health, as part of the commitments to the ministry. Medical internship offers a schedule that rotates through all the major and minor specialties, including emergency medicine, internal medicine, obstetrics and gynecology, pediatrics, surgery, dermatology, ophthalmology, otorhinolaryngology, infectious diseases, and psychiatry. Iraq. In Iraq, after graduation from a 6-year medical program, graduates start their internship in hospitals. The medical intern must finish a period of 3 months in each of the specialities of internal medicine, obstetrics and gynecology, surgery, psychiatry and pediatrics. Also, they work for variable periods of time in some of the subspecialties as assigned. Each specialty is given in particular courses of 3 months. After completion of internship, doctors are eligible to practice independently. According to the above definition of internship, interns have a degree but they are not fully licensed to practice medicine unsupervised. Currently the duration of internship is 2 years in the north of Iraq and 1 year in the mid and south of Iraq. Republic of Ireland. In order to register fully with the Irish Medical Council, graduates are required to complete 12 months of training in an approved public hospital. Internship comprises 6 months of medicine and 6 months of surgery. A minimum of 2 months and a maximum of 3 months may be spent in a subspecialty, including emergency medicine, general practice, obstetrics and gynecology, pediatrics, psychiatry, anesthesia and radiology. After completion of the internship, doctors obtain a certificate of satisfactory service which must be signed by the Dean of Medicine at the university from which the intern graduated. Upon receipt of the certificate, the Medical Council will entitle the provisionally registered doctor to apply for full registration in the General Register of Medical Practitioners, subject to payment of a fee. Israel. In Israel, medical graduates must complete 1 year in an accredited hospital prior to receiving full registration. This year of conditional registration is known as the intern year. Some residencies start at the 2nd year, including anesthesia, radiology, physical medicine and rehabilitation, and neurology. There are 2 kinds of internships outside the context of a categorical residency. Prelim internships are done in either internal medicine or surgery. Interns spend 12 months focusing on either internal medicine or surgery. Transitional internships, or traditional rotating internships, offer a schedule that rotates through all the major specialties, including emergency medicine, family practice, internal medicine, obstetrics gynecology, pediatrics, and surgery. Some applicants prefer transitional year programs because they generally are not as strenuous as a prel year. However, a prelim year can provide better preparation for the 2nd year of residency. Jordan. In Jordan, after finishing medical school, medical students receive the MD degree but may only practice medicine after working in a hospital for 12 months. After completion of this year of hospital work, the student will be licensed to work as a GP. Lebanon. In Lebanon, universities like the American University of Beirut, the University of Balamand, or the Lebanese American University, follow the curriculum similar to that of universities in the U.S. But other universities, that follow the French system like Université Saint Joseph follow the French curriculum. This excludes for example pre-medical studies. Instead the student is directly enrolled in a 7-year program during which he studies science and medicine. Mexico. In order to become a physician in Mexico, one must study 12 years of elementary and high school before entering medical school. Medical education includes 2 years of basic sciences, anatomy, histology, embryology, pharmacology, physiology, etc., 2 years of clinical sciences, cardiology, pneumology, dermatology, endocrinology, etc., 1 year of internship, in which the main objective is to become gradually responsible to manage clinical attention without supervision. Clinical areas included are pediatrics, surgery, internal medicine, obstetrics and gynecology, emergency department, community medicine. And 1 year of social service, whether the medical school one attends is private or public. After completing medical school, the medical student is able to obtain a license to work as a general physician. If it is of interest of this general physician to train in a specific field such as pediatrics, internal medicine, orthopedic surgery, etc., he/she must complete a residency program of 3 to 7 years to obtain a license to work as a specialist in such field. Curriculum of medical school at UNAM, MA copyright Zico. Nepal. After 4.5 years of medical school, every doctor in Nepal has to go through a 1-year compulsory rotatory internship in various specialities to get permanent registration in Nepal Medical Council as a physician. Internship should be completed from their own medical college as recommended by NMC. Only after getting permanently registered with NMC, one is licensed to practice medicine as a primary care doctor throughout the Nepal. The Netherlands historically had a 4-year preclinical phase completed by a master equivalent pre-doctoral degree followed by a 2-year internship phase, with similar responsibilities to that of a U.S. intern. The 2-year training would lead to an MD degree with license for independent practice upon successful completion. With the introduction of the bachelor-master system as prescribed by the Bologna process, the medical education curriculum has been modified in all of the 8 medical schools in the country to consist of a 3-year bachelor and a 3-year master program. The bachelor phase is usually almost exclusively preclinical, while the master will include internships, skills trainings and refresher courses, as well as a research internship. The master is awarded with an MD degree. Nigeria. The internship program is 1-year period in most of the hospitals in Nigeria. After internship program, which is done under the supervision of qualified licensed doctors. Each house officer is now required to do a compulsory 1-year program in NYSC web posted. During this period a provisional license must have been issued to house officer by Nigeria Medical and Dental Council in order for them to practice, temporarily with little or no supervision. Residency program is available for any medical doctor who wishes to continue in their medical career. Peru. In Peru, the medical intern is the 7th-year medical student who must complete the specialities of internal medicine, obstetrics and gynecology, surgery and pediatrics. In some universities, mental health is also included in the 7th-year curriculum. In some hospitals this period is paid. Slovenia. In Slovenia, medical graduates must complete a 6-month paid internship at a chosen medical institution. During the internship they must rotate through departments of internal medicine, surgery, pediatrics, OBGYN, ENT, ophthalmology, emergency medicine and anesthesiology, with emphasis being given to emergencies in each department. Completing the internship is a condition for taking the professional medical exam, passing which gives doctor a license to practice medicine in Slovenia and apply for a specialization. South Africa. An internship is a compulsory requirement that recently qualified doctors who are registered with the HPCSA work in designated hospitals under medical supervision for 2 years. They may work independently within this context in specified medical disciplines and for periods of time designated by the HPCSA. They are employed by the institution and this option is generally only available to South Africans. Foreign qualified doctors that have recently qualified and do not have the required medical experience to register with the HPCSA may be requested by the HPCSA to do their internship in order to qualify for full registration. They either do this back in their country or in South Africa. In South Africa, an elective for medical students is where a student arranges to visit a hospital for a short period of time to gain experience in a different medical context, where they will work under supervision and be mentored by experienced doctors. It is primarily a learning experience, they cannot work independently and are required to register with HPCSA if they are foreign student. Sweden. The Swedish equivalent to an internship is the Alma currency NTJA currency NSTGA paragraph ring, which is a requirement for obtaining a medical license. Its duration is stated as at least 18 months, but usually lasts a bit longer, 21 months in most cases. The students have to fulfill at least 9 months practice in medicine and surgery, 3 months psychiatry and 6 months as a GP. After the Alma currency NTJA currency NSTGA paragraph ring, the students have to complete a test from the National Board of Health and Welfare, to receive their medical license. Then follows specialization practice, the equivalent of residency. United Kingdom. The British equivalent of an intern is the Foundation Year 1 doctor, who is on the first year of their 2-year foundation program, and is provisional registration with the General Medical Council. Before the introduction of the foundation program in 2005, the equivalent post was called a house officer. Despite its technical obsolescence, the term house officer is still used by many clinicians. The foundation program is a 2-year-long training period in which competencies are developed and documented. Useful information on choices for foundation schools can be found on the Foundation's School Chooser website. United States. A medical internship typically lasts 1 year and usually begins on July 1. Internships come in 2 variations: a Euro-transitional and specialty track. After a physician has completed an internship and Step 3 of the USMLE or Level 3 of the COMLEX USA, he or she can practice as a general practitioner. However, the majority of physicians complete a specialty track medical residency over 2 to 7 years, depending on the specialty. The Accreditation Council for Graduate Medical Education officially dropped the term intern in 1975, instead referring to individuals in their first year of graduate medical education as residents. However, the American Osteopathic Association continues to require osteopathic physicians to complete an internship before residency. In popular culture, in the first 3 seasons of the popular television drama Grey's Anatomy, 5 of the main characters, Meredith Grey, Christina Yang, Isabel Stevens, Alex Kareev, and George O'Malley were surgical interns at the fictional Seattle Grace Hospital, where the series takes place. Also in seasons 4 and 5, George O'Malley and Lexi Gray are interns. In the first season of Scrubs, J.D. and Elliot are medical interns, and Turk and Todd are surgical interns. In Holby City, Tom O'Dowd is a house officer and Maddie Young, a senior house officer, is training to be a registrar or equivalent resident. In the Indian drama Dil Mil Gay, all the main characters are interns at the San Giovanni Hospital in Mumbai. In the popular Korean medical drama Golden Time, 2 of the main characters, Kang Jae-in and Lee Min-woo, are interns at a hospital in Hyundai, Busan. In the book The House of God, protagonist Roy Bash is an intern working in the fictitious House of God hospital. References: man.ac.uk A Doctor's Life, a personal guide to how doctors in the UK are trained and work within the structure of the National Health Service, UK Foundation School Chooser, rookiedoctor.com, useful for new interns, but also includes tips for family and friends of interns and what they can expect, www.universitycongo.org and